Probably the first line therapy would be some type of hormonal support, either with oral contraceptive pills or estrogen-progesterone combination. Additionally, the Mirena IUD and the Skyla IUD, both progesterone containing intrauterine devices, are a significant help for many women with abnormal periods. You know, oftentimes something like an office hysteroscopy that could define maybe a specific problem, like a small polyp that could be removed with a simple excisional procedure in the office under, you know, sedation and no general anesthetic. Or maybe something like an endometrial ablation, where the lining of the uterus is burned with a cauterizing or a hot saline balloon type device in order to kind of char the lining of the uterus and prevent it from regrowing and bleeding. That would be done in a woman that's is completed childbearing, because it does destroy the lining of the uterus. But it is a nice option for a lot of women that aren't quite ready for something as significant as a hysterectomy or a bigger surgical approach. If conservative options fail, or if it just makes more sense for the patient and her doctor to approach it in a surgical manner, then we have to consider what the specific problem is. Sometimes we can do surgery that involves just removing the problem, like a fibroid or like a polyp. That can be done in a way that would be minimally invasive and not require complete removal of the entire uterus. And then sometimes we determine that it's best for a woman to have a hysterectomy for heavy bleeding. Hysterectomy is the most common GYN surgical procedure in the United States and in the world. Hysterectomy has come a long way over the years, and for the most part now we're able to do hysterectomy in a minimally invasive fashion with small laparoscopic puncture incisions and a lot of times same-day surgical care and quick recovery, 2-week generally turnaround recovery from that procedure. It's important that a woman that is experiencing abnormal bleeding see her doctor, have a thorough investigation of the problem, and then once it's been determined what the problem is, we can arrive at potential treatment options, and there may not be a specific source or reason why a woman's having abnormal bleeding, but even in that case there still are both medical and surgical treatment options that are available to help women with abnormal bleeding.